Hey everybody, it is Jenn Kanata. Long time no see. I figured I'd probably try and do an update video on how things are going here in Kanata, Ontario, Canada, and how things are going. We're fine. We're okay. We're not great. We're now in week 7 or 8 a lot of the lockdown. So we were told to stay home. I think it was about March 13th. Well, that's when we were told because of my husband's coworker. Remember that of possible contamination. So that was also the day that our premier said that the schools would be canceled, and shortly after that, all the airports were shut down and all that stuff, and our prime minister was telling everybody, if you're out of the country, make it home until we run, sooner rather than later. And we still have some Canadians stuck in other countries. I have a friend of mine whose one daughter is still in Italy, stuck there, where it's really bad with this COVID-19. She was there on a school visa thing of learning Italian thing. So this was like her work abroad semester, and she was trying to, like, they locked Italy down before everything else. So she's been stuck there. At least she's safe. She's been in quarantine and stuff in lockdown. So it's fine. But she wanted to come home, but there was no way to get home. So she's fine until that is done. But it's a scary world out there. But we gotta just kind of do what we can to keep the cases low, the numbers low, and so that if the numbers are low, then the hospitals have enough staff to take care of the patients with optimum care. So they'll have enough time, enough staff to do all the work that needs to get done, but also a bit of extra time to also take care of the well-being mentally, of course, too, of the patients as well as the family members. Because at this time, unless you're a child, there are no visitors. Nobody's allowed to visit in the hospital for anything, whether it's COVID-19 or anything. Like people who are giving birth right now, they are allowing the husbands into the birthing room. And I think that's it. And they're not allowing visitors at all. This past week, we had our first visit at CHEO, the Children's Hospital of Eastern Ontario, for AbbVie's MDU unit. It was very different than it was a month and a half ago, 5 weeks ago, when last time we were there. When last time we were there, we were questioned of if we've been out of the country and all that, and our temperatures were taken, and then we were Purelled and asked where we were going. There was nobody wandering the halls, nobody doing anything. This time was even more so. They had the staff asking questions behind a plexiglass barrier and like a desk behind it. And then we went to the next station, and we weren't allowed to bring our own gloves into the hospital. Okay, we were asked to Purell. We were told we had to wear masks. We had brought reusable masks that we had just got the day before, and we're not sick, but we are preventing ourselves from if we are, carriers that we don't know, but we're asymptomatic. We don't want to give it to, especially in the MDU, because MDU is the medical day unit. That is where the children are going for dialysis, are going for oncology treatments, are going for IV iron, are going for blood transfusions. They're already having kids that are there that are immune compromised. Okay. I have a tickle in my throat. I'm not sick. It's allergies. It's spring. I'm allergic to the mold and all the leaves and pollen and all that stuff. So I do not have a cold or anything. There's a little tickle in my throat. But and this has been for a while. Anyways, when we went there, we were escorted. So a staff or a volunteer with a mask and that escorted us to our appointment. Opened the doors. We were told to Purell. We Purelled when we went in. We wore our masks. We followed them. We didn't touch anything. The only thing that was open was the coffee shop and the cafeteria on the first floor. And they had social distancing, that they were only like every 2 meters of people in line. And there was only about 5 or 6 people in line, and they were all like staff, maybe 1 or 2 parents type thing, because they're all wearing like hospital garb. Everybody's wearing masks at CHEO, so everyone had to wear masks. And we were told, because we had brought gloves to wear, and we put them on before we went into the door. Then we were told to take them off, and we had to Purell our hands. Went and did the appointment. The appointment went fine. They had all the rooms cordoned off with the curtains, and there's normally, and the rooms are fairly spread out anyways, right? Like there's a wall, like there's a 3-wall, and then there's a curtain, and then there's some rooms that had like a door, right? Especially those that need complete isolation, or if they're coming from an isolation room up on the ward, coming down to get the treatment, that is what they're doing. But they had kids in every second or third room. Usually when we go there on any other time the past 2 years, they've had kids in almost every room. Usually by the time we get there, our appointments are usually around noon, 1 o'clock. There's a little bit less, but it was so eerily quiet. There was no kids screaming or crying, no babies down there. There's usually at least 1 or 2 babies making noise. There was nothing. It was so quiet, so eerily. The staff were taking extraordinary precautions, even more so than they usually do. And the precautions that they normally do are really good, but they were like wiping everything down every time they touched anything, and anything that we touched got wiped down as well. And then afterwards they were getting the room sanitized. So that really eased my anxiety, fears of how the hospitals are handling. God forbid, we actually get sick enough to actually go to the hospital. The hospitals are handling amazingly. Even we walked by, to go to MDU, you walk by the hallway, you could see where Emerge is. It was quiet in there. People aren't going to the hospitals to Emerge for something that they think might be an emergency, might not. They're staying at home, how they should be normally. Usually Emerge there's always lots of seats filled, but I saw one person walking with a baby in Emerge. Okay, you have a baby, they get sicker faster, There was not that. So if you do get sick, call the hospital, check how things are. But I've had 2 people I know who have gone to the regular hospital near us, the Queensway Carleton and Almont. Those 2 we're kind of stuck in the middle. If you drive, you can go to Almont, which is a smaller hospital in the country, so there's usually less wait time. And then if you don't drive, or it's just quicker to go to the Queensway Carleton one. And both times they said they were like, what? There's one other person in Emerge, because they cut themselves. They needed to go to emergency. They needed stitches. So, and this is why all these things that they're saying not to do, to kind of prevent people from getting injured, to be going to the hospital and causing more strain on the system with staff that needs to be there for people who are really sick. That is why there's not, you're not allowed to go to the cottage and stuff, because if you go to the cottage, it's more prevalent in the bigger cities than the country. The smaller hospital, you're farther away from the hospitals in the country, and they're not equipped as well as the bigger hospitals. And if you get one case out there and you're going to the grocery store, and you are spreading it amongst all locals, then you have an outbreak. So they're telling people not to go to the cottage, not to hike. If you're allowed to hike on the trails, but you're not, but the parking lots at these places are closed. So if you're in walking distance to get to the trail, you can walk on the trails. You can't drive there or park, because this is the problem, is that people were congregating on these parks and just hanging out. You're not allowed to hang out. You can go to the parks, the local park across the street here, and walk around the park. You can't play on the play structure. We have by the high school here. We have a track. Every day I see 1 or 2 people walking on the track at any given time during the nice weather. But they're not parking. They're all, you have to, it's a walkthrough. You cannot stop. You're not supposed to sit on the benches. And it's just to get the fresh air. You're encouraged to exercise, but still do social distancing. We haven't done a lot of exercise though. If I had my tracker on my phone open, there's not a lot of walking going on. That's one thing I need to do more. What I found, so since we're in like week 7, is I need to get more active. I need to go out every day and just walk around. Walk around the block, walk around anything, you know. I can't just stay home. I go out once a week or 3 out of 4 weeks to volunteer at the food cupboard. I get a ride there with a staff person and ride home, and we don't touch anything, and during the whole time there we're wearing our masks and gloves and all that stuff, and sanitizing things whenever we need to. So there's not a lot of even contact, like, and the where I sit to do the phones, there's like 20 feet between us. There's not really a chance to get sick. So that has helped me and helped my anxiety and helped my fears of things, of going, I'm doing this as an essential service. The food cupboard is an essential service. They're supposed to stay open. They are run 99% by volunteers. There are 2 paid staff that are there to help with organizing volunteers, with organizing the programs, with making sure that there's enough food in the warehouse to give out to people, and then the rest are volunteers sorting the food and everything like that. Donations have been down of food items. Monetary donations is about the same, might have increased a little bit, but that is okay, because then they can use the monetary donations to buy the things that aren't being donated right now, if they can find them to buy them. We are now past, I think, the whole toilet paper stage, per se, of things, because the grocery stores still have normal packages of toilet paper, 8, 12 packages of toilet paper. Every few days, they're always restocked with the bigger packages when it comes in, but people buy them. Costco has been restocking toilet paper daily. Now, by the end of the day, or about 3 or 4, 5 o'clock, they might run out of toilet paper, or if in case a toilet paper is on sale, because they've been having them on sale too. And I'm like, how can you have it on sale when you don't even have it by noon? I did manage to get toilet paper yesterday from Costco. I didn't go to Costco. I had a friend who messaged me saying they were going to Costco. Was there anything? I'm like, oh yes, thank you, because I have not been to Costco since March 3rd. Okay. Is April 26th. Today is my daughter's 19th birthday. Okay. Today's April 26th. That's how long we have been home. You know, that March 13th was when we were staying home. But that's the last time I was at Costco. And I'm like, yes, please, because I couldn't get toilet paper back on the 3rd. I still had a package from January that we hadn't opened up yet. We managed to open it up last week. So I'm like, I still have enough toilet paper for 2 or 3 weeks, but I don't know when the next time somebody's going to go to Costco. So if you can pick up the Costco brand toilet paper, I like their brand better than the Cottonelle or the Cashmere. And there's more sheets per roll, and the rolls are actually bigger size. Like they're not much, but I think they're 0.2 or 0.3 centimeters bigger, and they're square because they take up less space on my toilet paper roll holder. So I know how much those last. So now I have enough toilet paper to last me for May, so I don't need to worry about that. But they had toilet paper. My friend went to Costco. She dropped it off at like 1:30. So it was afternoon, and she got toilet paper. And she said there wasn't an issue. Like there was enough. Like they were limiting one per person. So I said, if you don't need toilet paper, if you could pick up toilet paper. And she said, actually, I'm going to be planning on going to Costco every 2 weeks. So if you need anything in 2 weeks from now, make a list. And I'm like, oh, that is perfect. Now, the downside to this is that's going on her card, not my Costco card. So I'm not getting the points. But the convenience and it being dropped off, like she dropped it right here on my step. And then she left. I brought the stuff in. Actually, I wiped the things down that were in plastic or whatever, and anything in boxes I took it out. And left it, and it's all in the recycling. And wiped anything that I need to bring in the house. And then I e-transferred her the money. So, it's not as good as going to the store myself, because I can't get the specials, or I can't see, oh look, that's interesting, and try new things. I have to kind of go on what we normally eat, or what we need, and get stuff. So this time when she went to the Costco, things were on sale this week, like dishwasher tabs, dishwasher liquid, toilet bowl cleaner, the Lysol toilet bowl cleaner, the electric toothbrushes, which we've been wanting to get one for a while now, just been putting it off. It was on sale. That was the biggest purchase. But these things were, I didn't run out. I just know that they're on sale, and their price on sale is a great price. So I picked it up to put on my shelf. Oh, Ziploc bags, large and medium, and I think small freezer Ziploc bags. I know I'm out of them, almost the medium ones. I have whatever's left in the box. I still have some large, so I asked for large and medium. But I still have lots of small. Excuse me. And to go on my shelves, because I'm doing more freezing. I'm doing more trying to do meals to when I get the food. If I get something, I'm going to freeze it, you know. And that is what I'm doing. And with that, it was not a lot of food stuff. I got cream, I got eggs, I got milk, I got Parmesan cheese because it was on sale. I got fudgesicles, chocolate fudgesicles, ice popsicles were on sale, and stuffed chicken, which my family loves their stuffed chicken, which wasn't on sale, but it's a good price. It's cheaper than the store because they're packages of 8, while the store scared me. Nature's scary. And that's, I think, that was it, because there was no vegetables or fruit from them. It was all like cleaning supplies and household stuff and dairy, pretty much. The freezer stuff. Oh, there's pot stickers too. But now that I know that she's going every 2 weeks, in a week and a half from now, I'll look at the flyer, see if there's anything on sale, and get them stuff from there. This week I did not have any groceries. Nobody was going to the stores, so I did not pick up anything. We're using what we have. We have lots. Some things are running low. Oh, sorry, I had somebody pick up ramen noodles. Thank you, Jesus. Because my family's been eating ramen noodles. They love ramen noodles as a lunch or a snack. But I haven't gone to the dollar store. So somebody found some at Giant Tiger. They were 25 cents each, which is my buy price. So I said, pick up about $10 or $15 worth. And she did. So I got a mixture of some of some ramen noodles. So now I have enough for hopefully May, the rest of April and beginning of May, for my kids to have as a quick snack, or as, let's make a quick meal and make ramen soup and add a whole bunch of vegetables and meat into it. You know, use up those leftovers. So I'm like, it's a cheap way to add something to a meal. So we have that. Sorry, I forgot about that. But yeah, no other groceries. But we still have cheese and meat and stuff like that in the fridge and freezer. But health-wise, everybody's fine. Abby's health is the same as it has been for the past year. It hasn't gone worse, which is good. Her stomach pains and nausea is still there. Her weight has stabilized, so since being on quarantine, her weight has actually increased a little bit. She has been eating more regularly, more each meal. She's still eating lots of small kid-sized portions. I mean, she's 17 years old. She used to eat adult-sized portions, but she's eating like kid-sized portions and having snacks, and we've just been trying to feed her whenever we see her. So I think that's why she's gained some weight. And also not walking as much and exercising as much, but, you know, we're not too worried about weight gain, or we're just worried about weight loss, because we don't want her to lose weight, especially while being sick, while not having, because it's not going to help her with her energy. Rowan's finished school now. Well, till next year, and we don't know if that's going to be online or what. But she got, for this term, this whole year, first year of college, she got honors in all of her classes, so that she got the honor roll. So all of her classes were above, I think, 80, 85. Some of them were like 97. I'm like, okay, that's awesome. And that, so that's good news. And bad news is that this past week was my mother-in-law's birthday, and today is my daughter's birthday, and we can't go over there and celebrate because we can't have gatherings more than 5. And just to, because also my mother-in-law, she's 68, you know, we don't want her to get sick, you know. So we've been doing Sunday dinners at home, video chatting it through Zoom. And was it through Zoom? No, actually, I think we've been doing through Hangouts, because it's just the two or three households. Today, she said we're going to order Chinese, and we'll have some Chinese delivered here, some Chinese delivered over there. And that's what we're going to do for dinner with the family. But we're really missing visiting. I'm missing my nephew, I'm missing my sister-in-law and brother-in-law, I'm missing my mother-in-law, and yes, I do like my mother-in-law. And the kids are missing her too. And it's just, we need to kind of figure out a new normal, a new routine, because during the week my husband still works Monday to Friday from about 9 or 9:30 till 7, most days 6 or 7. Some days he's off at 5. So we've all been kind of getting up later, because the commute is short. And since he has to be there anyways till 5, 6 anyways, starting work earlier is not going to be much different. Like some days he does, because he can't sleep, and he wakes up early so he can get a bunch of stuff done, and then he might take a break in the middle of the day and take a nap, or take off early at the end of the day. But he's definitely putting in more than his, 40 hours a week, or whatever, 37.5 or whatever you're supposed to put. He's still stressed with work. There's lots of things that are hard to do from home, to manage from home, and to get everybody, like the systems at work, you have to connect into the work computer, are not made for having everybody connect at the same time. They're just not. And so it's a bit difficult that way. He has been finding that he actually gets more stuff done at work than at home most days, just because he has access to all the different things that are right there, versus him having to get a hold of a person through the phone to contact them, see if they answer. Maybe they're on a business meeting call with somebody else. You know, who knows? It's really just different and difficult. I can't wait till things kind of slow down here. Unfortunately, we had in Ottawa last week our highest increase of new cases, as well as a couple of deaths. Same with all of Ontario, where we had the highest number of cases coming up last Wednesday or Thursday, as well as a couple more deaths. I thought we were kind of evening out the curve. We are, but it's not going as fast as I want it to be. I want them to be less and less new cases, less and less cases of deaths, so that we can continue on to slowly go back to what we used to do. Like, I'm looking forward to going to the grocery store by myself with a friend, meeting up with friends for lunch, or just doing things that we used to do, like go to the thrift store. I am limiting myself to leave the house once a week, to volunteer, and if I need to go to the store. This week I might need to go to the store, since we didn't go to the store last week. And if I'm going to go to the store, I'm going to try and go to the Asian market to get a bunch of Asian dumplings and meat stuff there, the fondue style meat. Might be this week, might be next. I'll see how much space I still have in my fridge and freezer. But that is kind of my goal. I would love to go to the thrift store and just walk around. I used to just like doing that. I might have bought something up, but it was more of like entertainment. Love to go to the movies again. You know, that was our go-to entertainment. And I have movie tickets to go to the movies, like these Costco ones. Hopefully we'll be able to use them at some point. Because I'm okay if we're kind of still stuck at home. We are supporting locally. I've been doing a lot of my shopping, if I'm doing shopping, ordering stuff through Amazon or through Costco. We did Costco order. That hasn't come in yet. Of some household stuff that we needed replaced. I think it was light bulbs and stuff like that, because I could buy them online. But and we found a few places this past month that will deliver here. So a few local restaurants that deliver fresh food, or online grocery shops and stuff like that, which don't have a crazy delivery fee like the Instacart, and the prices are not crazy. Like, not everything is more expensive. Some places, their prices, we found one yesterday that their prices on everything was reasonable. It might be about 20 cents more than the grocery store, my go-to price of some things, but not a lot. Like, a lot of the stuff on Instacart was like $1 more or more than what I would normally spend. Plus, they had a delivery fee and a service fee and a tip fee. Well, most of these places, if you spend over $100, you get free delivery. And I like that because I can easily do two weeks worth of stuff and throw it into a cart for $100, you know, or buy a month's worth of meat, you know, or a month's worth of bacon, a month's worth of chicken, whatever, one item of being like $50, easily. Now, having the space to put that stuff is the other story. Anything else? We don't have any more CHEO appointments until the 5th of June, like the ones that we have to go into the hospital. Abby this week had 4 CHEO appointments. 3 of them were, one of them was a phone call appointment, and 2 of them were video conference appointments. And then one we had to go in to get her IV iron, because they can't do that virtually, apparently. You have to actually put a needle in you. Go figure. And next week we have one doctor's appointment on other virtual. So this is a thing, we're still having once a week appointments, but we're not going to CHEO. So it saves money that way. And time. Like, I just have to make sure she's up to be up for the appointments. So that part I'm liking about this lockdown is them figuring out that they can do virtual appointments for most things. Now, they still have to see her eventually, but when they going to see her, they'll combine it with other appointments. But these virtual appointments, really, for me, living out here in the suburbs, it's an hour and a half on the bus, or a 30-minute car ride, 20 if there's no traffic. But still, it is saving time and money. And I hope they continue this once all this pandemic is over with, of having as an option, do you want to have an in-person appointment or a phone appointment, or a video appointment, because they're in their offices anyways. That's one thing. Another thing that I've been enjoying about this lockdown period is I have more time to kind of like search around my neighborhood or my community of what programs and stuff are out there, what free programs, what paid programs, what things that we can do, or what services are available for even a cost. Like, I don't mind necessarily spending a delivery fee on something if it's something that I'm going to use. So finding these things that, if in a pinch, like our community center, in a pinch, if I need groceries because we are on the list and we have disabilities, or it's for people who have disabilities, have a senior or immune compromised, or anybody who doesn't have a ride or anything like that, they will offer to do groceries for you. You give them a list, you call them, you give them a list, they do the groceries, and then you pay for them. The problem with that is, like, not so much a problem for us, because I will always have that money in my account, because I get my grocery pay money, but some people might have more limited income and don't have a backup of things. So with that, they are limiting, there might be problems with the person picking up the stuff and then getting paid, and that's the downside. That's why I like doing it myself on the computer, so I know exactly, oh, this is $100, this is how much it's going to cost, versus giving a list and not knowing how much things cost, because I'm like, oh, can you pick me up some chicken breasts and some steak and some stuff? I don't know how much it is. I can't see the price, and whether you're getting me 2 steaks or 4 steaks, there's a huge difference in price. But there is that option, which I'm very thankful for. And I'm very thankful for, I'm on a few of the mom groups, and that especially for ones that for this Corona-19 pandemic, they're offering help. People are saying, okay, I'm going to, the pharmacy here on Saturday, does anybody need anything? And they'll pick up some stuff and drop it at their step. A few things. They're not asking for a huge grocery order or anything like that. Or, does anybody need to pick me up? I just made, cookies. Now, I mean, you can do with what you want. Like, you take your own chances and stuff like that. But these are, well-meaning gestures. And you just have to respond yes or no if you want them. If you don't want them, if you don't want to take the chance, then don't respond. It's that simple. right? But just seeing the community caring and trying to help one another has really helped my spirit and helped my anxiety of realizing that we're all in this together. It is all a storm. You're all in this tornado of life, how it is right now, together. Where we are in the storm, if we're on the outskirts, are we in the center? Are we in the turmoil? We're all in the same storm. We're just dealing with it a little bit different, and it's affecting us a little bit different. But to keep everybody safe for as long as possible, we all need to just stay home as much as possible. Wash your hands. Use Purell when you're out. Wear gloves. Wear a mask. To protect you. It protects you a little bit. But really to protect people out there. Because at the end of all this, I want to see all my friends and family and acquaintances and co-workers or whatever. Again, I don't want to see anybody missing because of this pandemic. So stay safe. You can do this. If you want to message me below, please do. Contact me, chat, whatever. We're all in this together. We will all be okay eventually. Sometimes it'll be hard financially. A lot of people, more people are being financially affected. We are only slightly being affected, not that much because of my husband's work. He is getting paid to work from home, and that's our major income. But other things, like, we're all being affected somehow by it. But we can do this. We will get through this. And at the end, we will be okay. So, thanks for watching. Lots of love from Kanata, Ontario, Canada. Stay safe. And please be kind. Bye, friends. See you next time.